Great. So hello and welcome to this webinar, which is being co-hosted by ODI and the Gender and Development Network, titled Realising Rights, How Can Social Protection Advance Gender Equality? This is the first in a series of webinars that ODI is hosting on the theme of social protection and gender equality, and all of them are going to be available on the socialprotection.org platform over the next few months. Just a reminder that this webinar is being recorded, and a recording of it will be available on the platform to view again. Before we start today's discussion and before we introduce everybody on the panel, I'm just going to hand over firstly to Rupa Hinton from the UK's DFID. She's briefly going to introduce the series of webinars they're convening in collaboration with ODI. Over to you, Rupa.
Thank you, Francesca. So there's increasing recognition that by strengthening the gender focus of social protection, we can transform gender relations and outcomes for women and girls. However, social protection systems are often not deliberately designed to do this, and we're missing an opportunity to transform women's and girls' lives. This year's Commission on the Status of the Women gives us a great entry point to discuss and agree the role of social protection alongside public services and sustainable infrastructure in empowering women and girls and promoting gender equality, and to create a momentum for this shift in global practice that we want to see. So DFID wanted to organise this webinar series with ODI for a number of reasons. Firstly, if we're to generate this momentum and a sustained shift, gender equality, where gender equality is routinely integrated into programme objectives and design, we need to initiate a broad-based conversation on this agenda. What it is, why it's important, and what steps we need to take to have that transformative impact. Secondly, we need to bridge across disciplinary divides, so between gender expertise, policymakers, programming, and social protection expertise, policy and programming, in order to make sure that social protection empowers women and girls, but also that it's seen as a crucial part of the policy and programming toolkit for those that are trying to promote gender equality. And today's webinar does just this, working closely between the social protection and gender equality communities. And finally, through this webinar series, which will culminate in a public event in May, we wanted to deepen the discussion on some key elements of gender responsive social protection that are both important but often less prominent in discussions on the issue. So in the next webinar, we're going to look at political economy and incentives for increasing the gender focus of social protection, one of the most important factors in determining whether this shift is going to take place or not. And the third webinar will look at issues around financing and gender responsive social protection, where we often see the gender distributional effects of tax and transfer policies are not well understood, but often also not well integrated into policy making. So hopefully through this series, we'll be able to build on the Commission on the Status of Women and identify and prioritise actions that are needed for gender responsive social protection to achieve its potential for women and girls. So I'm going to hand back over to you, Francesca. Thank you.
Thank you very much for that introduction, Rupa. And as you mentioned, the topic that we're discussing today is really high on the agenda with the UN Commission on the Status of Women, which happens next month in New York, has taken the priority theme of social protection systems, access to public services, and sustainable infrastructure for gender equality and the empowerment of women and girls. Gender equality and social protection are also both crucial to achieving Agenda 2030, both are goals in themselves and then both also related to many of the other targets and goals. So against this background, what we've asked our panelists to help shed some light on today are the following questions. So firstly, how can social protection advance gender equality? Secondly, what lessons can be learned from existing social protection policies and systems towards reducing gender inequality? And lastly, what are the key challenges to implementing gender responsive social protection policies, and how can this agenda be accelerated moving forward? So we have three panelists today and each bring a different perspective to this topic. So I'll firstly just introduce myself properly. My name is Francesca Rhodes. I'm chairing this panel as an advisory group member for the Gender and Development Network, and I'm also a gender policy advisor with Oxfam GB. Our first panelist will be Shahra Razavi. She's the Chief of Research and Data Section at UN Women and the lead author of the UN Secretary General's CSW report this year. Secondly, we'll hear from Bijal Bhatt. She's the director of the Mahila Housing SEWA Trust, and she's bringing a practitioner perspective to her presentation. And finally, we'll hear from Francesca Bastagli. She's the head of the Social Protection and Social Policy Programme at ODI, and she's going to talk about the research perspective on this topic. So their full biographies can be found on the website for this. We've just shown them very quickly there. Each of our speakers will present for around 7 minutes each, and then afterwards we'll have a question and answer session. So we have participants joining the webinar today from around the world, and we really want to make it as interactive as possible. So please do send in your questions for the panelists to be posed later on in the webinar. You can do that by posting them in the chat box on your screen, and then I will pose them to the panelists later on. And if you're comfortable doing so, please could you include the details. So for example, please include your name, your organisation if applicable, and also the country where you're based, and that will help us make sure that we have a good balance in the questions that we're asking later on. We'd also really encourage everyone to continue the conversation on social media. So on Twitter, you can use the hashtag CSW63 and the handles at ODI Dev and at GAD Network, so GAD_GAD Network. And there's also the hashtag of SPORG webinar, which is the social protection webinar hashtag there. So to get started, I'll now hand over to our first speaker, Shahra, and she's going to outline the key messages of the UN Secretary General's CSW report.
Good morning, good afternoon, everyone. Am I being heard? I hope that, yes, okay, very good. So thanks very much for this opportunity to say a few words about the Secretary General's report for the Commission on Status of Women. First of all, let me just take a minute to say that the Commission on Status of Women is the principal global intergovernmental body that's dedicated to the promotion of gender equality and women's rights. It has as its task the task to document reality of women's lives and to really shape global standards. So it's very fortunate in many ways that the Commission chose to focus on the priority theme that we have before us, which brings together social protection systems, access to public services, as well as sustainable infrastructure. A trilogy that I think provides the opportunity for great synergies as we look to social protection systems very broadly conceived to really make a transformative change in the lives of women and girls. Also very significant that there is quite a nice resonance between the way in which the priority theme has been framed and the details that we see within the Agenda 2030 on the target, particularly on 5.4 on recognizing and redistributing unpaid care work, which also has as its policy components exactly the three components that we have in the priority theme. So with that introduction, let me just say that this commission is taking place, the CSW 63, in a context where we have global evidence to show that women are at an elevated risk of extreme poverty compared to men. We've been doing some work with the World Bank, and when you disaggregate the data by age group, it's quite significant that in the 25 to 34 age range, what you see is that there are about 122 women for every 100 men who experience extreme poverty. So we have this elevated risk of poverty, particularly in the age group where people are combining unpaid care work, reproductive work with earning an income. And women are clearly at a disadvantage in this age group. We also know from a wealth of evidence from many different international organizations, in particular the ILO, that women are also more likely than men to be working informally, with little access to the raft of employment and social protection rights that are conferred on workers who have a formal employment contract, and that within the informal economy itself, women often occupy the least secure and lowest paying jobs, for example, as paid domestic workers or unpaid or contributing family workers who are employed without any kind of direct pay in family businesses and family farms. And also we know that one of the factors that's driving some of these disadvantages in the labor market is the fact that globally women shoulder about 3/4 of the unpaid care and domestic work. We know this work is very essential for the reproduction of societies and economies, and it's the foundation of any productive economy. But at the same time, we also know that the costs of providing this kind of essential services is overwhelmingly being borne by women. So this is kind of the context within which CSW is taking place. And I would really want to sort of echo what Rupa just said about the fact that the CSW, with the way in which this priority theme has been framed, provides an incredible opportunity for tackling many of these challenges, which require investments in gender-responsive social protection systems, public services, and sustainable infrastructure. And it's not just a question of extending existing systems to cover women and girls, but also of making changes in the design, very often, of the systems that we have, so that they do actually become gender-responsive and they can meet the needs of women and girls, and particularly of women and girls who experience multiple forms of discrimination and who need particular provisions that are tailor-made to their particular conditions and constraints. Now, let me quickly just say some of the main themes that come out of the Secretary General's reports. The report does recognize that there has been important progress in improving women's and girls' access to social protection, public services, and sustainable infrastructure, but that there are important gender gaps and biases that remain in the system. Just to take a few very obvious examples, we know that something like 41% of the world's mothers with newborns receive any kind of maternity benefit, and that regional coverage is very uneven and can be particularly low in some regions. In sub-Saharan Africa, only about 16% of mothers with newborns have paid maternity leave. Or if we look at access to old age pensions, globally there is still around an 11 percentage point gap between women and men. There has been progress in having non-contributory systems of social protection, which are obviously very important in reaching women who are not in the formal labor market and who don't have the kind of contributory history that would give them access to contributory entitlement. However, the problem has been that with this non-contributory system, the benefit levels have often been relatively low and not sufficient to lift women and their families out of poverty. And even when women are relatively well covered, they continue to face disadvantages vis-a-vis men. Even if you take an example of the European Union, for example, women's pensions on average still are about 37 percentage points lower than men's. So the inequalities remain in these systems. Gender-responsive public services, the report puts a lot of emphasis on, play a very critical role in reducing poverty and inequality and in advancing the rights of women and girls. However, to do so, barriers that constrain access need to be removed. And particularly, we know when public services are delivered through private providers, it can cause gaps, in particular in terms of access by women who are relatively more disadvantaged, poorer women, rural women. So it really does remain the responsibility of the state to make sure that even when you have mixed systems, that the public services are affordable, they're of adequate quality, and that women, for example, in rural areas, women in poorer households do have access to quality services. We know in particular quality and affordable child and long-term care services are very important and can be very effective in increasing women's employment while also providing quality care to those who need them. So this is a particular area that we really need to think of as the need for investing in these services. And also much greater efforts are needed to mainstream gender into sustainable infrastructure. We know that when basic services like clean water and safe and clean fuel is not within reach, then a huge amount of time is spent collecting fuel and firewood, which compromises women and girls' health, their access to education, and having valuable time that they could have otherwise spent on going to school, doing homework for girls, or playing, and for women, time that could have been spent in having, more time for productive work, as well as for having time for education, for rest, for leisure, for ways of really recuperating and building up their own human capabilities, which is also very important. Now, there is a great opportunity to harness these synergies if we have greater coordination and if we avoid trade-offs between these three areas, and to maximize these potentials for promoting gender equality, social protection, public services, and sustainable infrastructure need to really work in tandem. And this is something that we have seen over the past 2 decades, when there has been greater emphasis, for example, in getting cash transfers to women. This is an important area of progress. We know that, and we know evidence that it has been quite effective in terms of giving access to education, for example, increasing access to education, to health services. But we also know that there have been huge problems when there haven't been commensurate investments in those services. Without adequate investments in health and education services, the fact that there is increasing demand for those services because there are incentives within cash transfer programs to increase demand, it could just simply mean that women and girls are being pushed into services that are of low quality. And without, for example, viable transport alternatives, rural women and girls may spend many hours walking to schools or to health posts to fulfill program conditionalities, and yet they're not able to really gain the benefits that come from access to quality services. Investments in public services and sustainable infrastructure provides opportunities for advancing gender equality in employment as well. We know that investments in public services can be also in themselves an engine of job creation. Particularly, we know that care services can play this role very well. But the report emphasizes that equally important is to make sure that investments in infrastructure do provide openings and opportunities for women's employment within those kinds of infrastructural services as well, so as to reduce the gender segmentation in labor markets. But finally, I think it's really, really important, and the report does also emphasize the critical role of finance. Progress across the areas will require a significant injection of resources, and the report emphasizes the fact that these are not just simply expenditures in the macroeconomic sense, but investments with longer-term payoffs. So it's critical that such the domestic resources as well as other resources are raised in ways that are gender responsive and that are not biased in the way that they impact women and men, and that they're spent in ways that do really enhance the investment in services in ways that can unlock the kind of constraints that women and girls face. So very important to watch the way in which resources are raised, the kind of tax systems that we have, the kind of ways in which resource gaps are being addressed, and also to make sure that in doing the expenditures, we do really have gender responsive expenditure by using, for example, GRB to make sure that money is going into those places where they're most needed. And I think there was a question about what are the gaps in the Secretary General's report. Maybe during the discussion I can come back.
We can come back to that maybe, just so we've got enough time for everybody to fill in first. Brilliant, thank you so much, Shahra. So I'm just going to hand over next to Bijal, and she's going to talk about SEWA's experience in particular of how social protection facilitates gender equality.
So hi, my name is Bijal and I am from the Mahila Housing SEWA Trust in India. And we work primarily to improve the habitats of poor and ensure how cities become more and more inclusive for poor women in the informal sector. So just to continue the conversation, in my country, in India, informal work constitutes almost 80% of the women's of the workforce, and women are 94% in this. And their workplaces, their home-based workers, almost 40% of the total urban employment, they use house as their workplace. They use streets, they use waste dumps, but all of them, even if they are street vendors or waste pickers, use their house for segregation or for storing their goods. So their house is their workplace, and the biggest issue is that of recognition of their workplaces and of the fact that social protection is not a welfare for these women, but it's their right because they are workers. So their recognition as workers is very important. The other thing that we found, and I'm going to concentrate more on my experience in public infrastructure and sustainable infrastructure for women, was that many of our cities in India don't have mixed use, mixed zoning policies, so which will not allow the recognition of small businesses which are being run from home by these women, and they would not get access to critical infrastructure like water and electricity, which increases their productivity, reduces their occupational health risk. And so having mixed use, mixed zoning policies is very, very important. In our different programs, we also found that access to sanitation, paved roads translated immediately to reduced medical expenses by 56% by the women. There was 17% reduction in waterborne diseases. These are all doorstep services. Increased children education. And the risk of loss and damage of goods because of not having waterlogging was really, really very evident. And these women have the habit of storing food so as to ensure food security the year around, and these gets lost if your houses really get inundated because you have no stormwater drainage. The other issue which came up was that accessibility of accessibility of transport. Safety and costs were extremely important to these women workers who were rehabilitated into different housing sites due to big programs like riverfront development, etc. One of the things that we also observed was that when such rehabilitations, although they were being given alternative legal housing by the government, the timing of such rehabilitation was very, very important, because this not only meant that they were being removed from their housing and they would take time to adjust, but it also meant that they were losing out on their formal identities at one place because of change of address, and they were making a lot of investments into getting and rebuilding their identities at a new place. Because of an inappropriate time that the rehabilitation took place, the children also lost out on education and did not continue. So that came out as very, very important, the timing of rehabilitation, due to big infrastructure programs. And I think they also want their housing and workplace to be climate resilient now, because urban areas are, getting flooded more often than before. And across South Asia, I think flooding and increasing heat stress, because we are all driven by heat. So increase in heat stress, flooding, vector-borne disease, these incidences are increasing, and therefore we need their workplaces and housing to be climate resilient. Our experience, because in our approach, what we do is we try to empower women and girls for interacting with the government. So first of all, our experiences is that there's a lot of discussion around women's empowerment and decision making in their homes, but I think it needs to be dealt differently when we are talking of public spaces. It's more their ability to interact at all levels of government. So while policies will get made at the federal level, for their implementation, they still have to interact with the local and state governments, and therefore they need to understand the governance structures. The political regime also they need to understand. Our experience also has been that there is great resistance to empowering adolescent girls. So the traditional subjects that they would be empowered would be about menstrual hygiene or adolescence. But we have been trying to involve them in making governance more transparent for them. And this ensures intergenerational changes, and it's a different topic. This requires them going out of their houses and talking to the government, and that is where the real challenge lies, because you have to really, really mobilize their families. And to be able to increase this ability to ensure participatory governance, we need to train them about political ideologies, representation in political manifestos, about urban planning regimes, governance structures, and also to try and tell them that you have to put your needs first, because they are so much used to caregiving for others. They always try and compromise or ignore or take their needs as given, which is a very huge phenomena that we are experiencing, especially in highly paternalistic countries like India. And capacity building to decipher the budgetary processes and intervening at the right time so that budgets get allocated for sustainable infrastructure, which address their needs, and also for social protection. And it's then really, really very important to understand for them the intersectionality between social protection and infrastructure. And so you have to train them to use a systems thinking approach, a much approach which intersects with different elements, and that really is the crux. How do you teach or build the capacity of such complex issues for these poor women? And I think we have been trying to do that very well by investing in communication material for building their capacities. I'll also like to talk a little bit about the social protection design and cash transfer experience that SEWA had done. And we understand through our experience that poor women and their associations sorry know the needs best, and they should be included in development, design, implementation, and monitoring. It has to have a life cycle approach. And some of our cash transfers that we did in a pilot project in India showed that women invested in toilets where they were given cash transfers as compared to the control villages. Women also invested in drinking water at household level and irrigation water, particularly in tribal villages. And the investment, there were investments in improved cooking sources, lighting and energy. As compared to control. And especially tribal villages recorded a big increase in household assets and transport systems because they were so far off from the urban centers due to the cash transfers that we had undertaken. And so far as sustainable infrastructure is concerned, we've seen that women are increasingly demanding that their housing and community infrastructure is designed in a sustainable manner so that their houses don't get flooded, because otherwise they really lose out on their goods that they have stored for work. Their productivity gets compromised, and their food security is really compromised. And that's what we are trying to do. We are at the moment trying to design insurances that would take care of things like loss of work days, because they do really lose out on work days, and that's what we are trying to do at the moment in India with social protection, sustainable infrastructure, and women. Thanks.
Brilliant. Thank you so much. So I'm now going to hand over to Francesca at ODI, and she's going to talk about the research in this area.
Apologies, I believe I was still on mute. All right, so I'm back now. So just to say that there's a large and growing body of evidence of just how effective social protection can be in promoting women's and girls' outcomes over the course of their lifetimes as they encounter, as they go through different life cycle events and encounter different risks, and how important social protection can be in tackling gender inequality. Now, this is true for a whole range of social protection instruments. So we know a lot about just how the scale of impacts of in-kind and transfers and services, cash transfers, whether of a contributory nature, of a non-contributory nature. There's, as I say, a wealth of evidence on how effective they can be in improving access and utilization of services, importantly, girls' school attendance and learning outcomes, utilization of health services and associated impacts on health outcomes, including maternal mortality, reductions in maternal mortality, but also evidence of how social protection can promote participation in paid work among women, movements away from casual labor into better forms of employment and decent work. We see evidence of reductions in early marriage, postponement in marriage, and a whole host of very positive beneficial impacts on a range of indicators. And these indicators include ones that are perhaps less tangible, and some of the issues Bijal was just pointing to. We see how social protection, if well designed and implemented, can help promote dignity, confidence, and we've seen this particularly among women who have up until recently essentially not experienced any access or limited access to public services, and for whom social protection, the introduction or extension of social protection, has really represented for the first time access to public services and recognition from the state and government. This has, led women to feel less invisible and to important processes of emancipation, including with regards to increases in demands for services and entitlements, which is an important impact of social protection. Now, a key qualifier here is that this is true for social protection instruments that are well designed, so the details of the design and implementation of policy matters tremendously. And there are examples of social protection interventions that do not lead to significant effects or in the direction intended for women and girls, and as well as examples of instances when they may reproduce existing gender inequalities. And there are two areas of concern I just want to briefly raise. One is that despite considerable progress in extending social protection coverage to women and girls, women continue to remain at a higher risk of exclusion from social protection. So there's an issue around coverage, and Shahra already illustrated this very clearly. Women continue to be at a higher risk of exclusion from social protection compared to men. A second related issue is one of adequacy. So even when they are covered, they tend to, on average, receive lower levels of support compared to men. This is a result of a range of issues, and we might go into this in greater depth during the discussion, but a key factor that continues to drive this outcome really is related to existing inequalities in the world of work. So in particular, the type of work that women tend to carry out, the sorts of work trajectories they follow. So they're the fact that they tend to are more likely to work in part-time work or follow interrupted patterns of paid employment compared to men, the fact that they continue to receive lower remuneration on average compared to men, has important implications for eligibility to social protection and the adequacy of social protection provision. So there's a persistent issue around questions of coverage and adequacy. But even when social protection does reach women, and in fact, even in cases where social protection explicitly targets women, is designed for them, there are instances in which such schemes may end up reproducing gendered inequalities. And I think, again, one of our roles is to pay particular care in monitoring and analyzing these situations. This can result as a combination, results from a combination of things, but including in many cases, the assumptions that underpin social protection design regarding women's roles in society. So as you will have seen in some countries, the establishment of social protection systems based on a social and family model of a male breadwinner and assumptions about women as a primary care provider may lead to policy that tends to reflect and continue to reproduce this sort of arrangement. And related to this, a key factor that continues to lead to these sorts of configurations is the way in which we continue as a society conceptualize and value work and the persistent unequal distribution of unpaid work between the sexes. And I'll just give a quick example. Again, Shahra has already alluded to these issues, but the expansion of cash transfers over the last few decades, which in part was an effort that was made precisely in response to coverage issues, and so the expansion of these cash transfers, these are non-contributory social assistance transfers, motivated by an objective of expanding coverage among excluded groups, including women, in some cases has in fact contributed to the reinforcement of women as primary care providers in the family, particularly when these interventions are designed, yes, to target women, but primarily in their role as mothers or as primary care providers. Now, there are very important examples of the ways in which these issues have already been tackled. Important new legislation that helps to that directly has aimed to address some of the formal legal barriers to effective and adequate social protection coverage for women. And I'm thinking, new legislation, international, but also national on social protection for domestic workers. There have been adjustments to the design of social insurance, so contributory schemes to help ensure that women are eligible and can participate independently of the types of patterns of employment and the level of pay. And of course, we've already talked about efforts that have been made in the area of social assistance to expand non-contributory social protection to improve coverage. Now, in many of these cases, in particular, we've seen successful outcomes where these efforts have been accompanied by on the one hand, investments in complementary services, including, importantly, public services that are of value to women, and infrastructure. And this relates directly to the core theme of this year's CSW and the UN Secretary General's report that Shahra outlined for us. But also they've been accompanied by efforts and initiatives in the area of labor markets, and sort of labor legislation and labor regulation. And important examples include legislation on minimum wages, but also initiatives to introduce or strengthen parental leave, not just paid maternity leave, but also paid paternity leave, and incentives to help ensure that men take on these leave entitlements. Before I wrap up, I'd want to just very quickly raise 4 critical issues that stem from all of this, and these are key questions on which, in my mind, there's still very lively ongoing discussion, and where we need to do more on. One core question is one regarding the balance between contributory and non-contributory social protection. So, as we've said, in light of and in response to the persistence of high informality, rise in non-standard forms of work, growth in in-work poverty and in low pay in some sectors, and all the associated challenges related to paying contributions and expanding or sustaining contributory social protection, the response in some circles has been to advocate for essentially the expansion of non-contributory social protection and the allowance of the withering away of contributory social protection. In my mind, this is, and in the mind of others, I'm sure, is extremely problematic, among other reasons why why this is the case is, of course, that contributory social protection has a critical role to play because of these some of the principles that underpin it around risk pooling, around solidarity, around redistribution, and the critical role it plays in terms of strengthening a social contract between the worker, the employer or capital, and the state. So, but there remains a very lively and important debate to be had there around, where do we go moving forward in the balance between contributory and non-contributory social protection, and how does this matter for women? A second related point that has come up a lot already concerns the way in which we value the valuation, questions around the valuation and redistribution of unpaid work. Women continue to carry the bulk of work that is unpaid or of low monetary value, despite its being hugely valuable to society. And this affects the way in which social protection functions in practice. So however hard we try to design social protection policy that is gender responsive, the truth is we will need, we do need to rethink about how we value work, and we do need to make wider efforts to tackle the unequal distribution of unpaid work and the gender norms that facilitate this unequal distribution. Otherwise, the reality is we can only get so far through social protection, and social protection, for it to be effective in terms of advancing women's and girls' outcomes, will require initiatives, wider policy efforts around gender norms and the way in which unpaid work is valued. A third point is on representation, precisely because we, as we've already heard from Bijal and Shahra, a high share of women in the world of paid work in informal economies, are more likely than men to participate in non-standard forms of work, to work part-time. They also have traditionally, and to this day, tend to be less organized as workers in a group, and to be less visible. Now, in a context in which we're seeing weakening of trade unions and collective bargaining efforts, this means that we have to, in this stage, provide even more support and be even more sort of careful and supportive of worker organizations and solidarity networks in these sectors to help ensure that women and women workers are given voice and are given opportunities to participate in these discussions on policy options. A final point on financing, again, this is what Shahra closed on, but I do want to just re-emphasize this. A lot of what we talk about, particularly as social protection experts or analysts, is about the spending side. How, what do we deliver? How do we deliver it? What's its effectiveness, and how does it impact women and girls and equity? Which is all very well, but unless we look at the funding, the financing angle, we're only looking at part of the story, and we might actually be telling quite a misleading story. And when it comes to financing, we need to do these two things. I mean, one, we need to be careful about the levels of financing required, so levels of revenue that are necessary to provide adequate, good quality public services that are otherwise not taken on by women. But beyond the question of levels of revenue that are required to fund these services, there's a question of where the financing mix, so where this revenue is coming from. And this links back to the wider conversation around contributory versus non-contributory social protection. If, as we are seeing, there is in some countries a move towards relying increasingly on non-contributory, so social assistance, social protection that is predominantly tax financed, then even more so we will need to pay particular attention to where, to which tax instruments governments are relying on, their implications from an equity perspective. Now, in countries in particular where we know tax systems tend to be regressive, and which means that they fall disproportionately on poorer or marginalized and low-income groups, and may even fall disproportionately on women, we need to be particularly attentive and careful to this issue. Just a plug to say that one of the upcoming webinars will look at this issue in greater detail. Thank you.
Great, thank you. So we'll move now into the Q&A session. So the other presenters you can put back on your webcams and microphones. And I'll be posing questions that are coming in groups of 3. If you have questions, there's still time to put them into the chat bar. So I'll ask 3 questions in a row and then give each speaker a chance to respond. So the first question that's come in is, so that there's a need to address social norms that hinder women and girls' capabilities and access to social protection programs. Is there any research looking into addressing social norms to promote gender equity in social protection? Secondly, what do we know about the impact of digital cash transfers? So are there certain behavioural or contextual aspects that one needs to consider for creating benefits for women by implementing cash transfers into bank accounts? And thirdly, a question specifically for Shahra, but others are welcome to answer if you have thoughts. So you mentioned that the percentage of paid maternal leave in some countries is as low as 16%. What could be the strategy followed to ensure that paid maternity leave does not have a backlash in labour force participation of women, so it doesn't have any unintended consequences, I think? So there's those 3 questions. Perhaps Shahra, I'll come to you first to be able to answer that first question, and then also any of the others that you wanted to comment on.
I think I'm unmuted now, right? You can hear me. Okay, great. No, I think that's a really important question to ask, because I know that in India there's been also this debate around paid maternity leave, and where the leave, the paying for that leave is increasingly sort of the burden is shifted onto employers. That can create a disincentive for enterprises to employ women. But I think we need to be very careful with how the financing of paid maternity leave is actually designed. And we know in parts of the world where the system is increasingly focused on employer provision of the financing, it can be a source of bias against employing women. But I think, the ILO Convention on Maternity Leave is very clear in terms of how this has to be done, that it has to be financed through collective provision. And that's why the social insurance mechanisms are so important, where it's not, first of all, only financing for maternity leave that is included, but also financing for other kinds of social insurance. It's collectivized, and that it's not particular employers who pay for it, and that it comes out of a collective pool, so that all employers are contributing. There is risk pooling, and there is not the bias against those who are employing women. So I think that's really important. But generally, it has proven to be quite difficult to extend these social insurance systems for maternity leave to cover. It has been easier to cover wage workers, for example, domestic workers that Francesca referred to. South Africa and several countries in Latin America have had more success in extending contributory systems to cover, for example, wage workers, domestic workers, seasonal workers. It's much more difficult to cover women who are self-employed, women who work in the informal economy but are self-employed. And for those, I think non-contributory systems tend to work better. But again, where it's left and it's voluntary, it's very difficult for women who have very low pay and cannot make regular contributions to be able to get coverage. So I think Allow PDR has tried with a kind of voluntary system, and that has not increased coverage for self-employed women who very often have very irregular incomes, very low incomes, and they cannot kind of make that contributory history to be able to claim sufficient benefits when they do need it. So I think, again, I mean, this points to some of the limitations also in terms of experience that we have, how to increase coverage for self-employed informal workers. So we do need to be looking to having, systems that are more insurance-based and where there is collective financing rather than shifting the burden onto employers. I think that's a really important sort of article to keep in mind. And also, if we are going for systems where people are paying into an insurance system, that if it's left to being voluntary, it won't really be very effective in giving wide coverage. So a tax-financed, non-contributory way of providing maternity benefits can probably work in a more effective way, which again brings us back to the question of, if we are putting so much emphasis on tax-financed non-contributory systems, then we have to be thinking much more about how that financing is to happen. Because one of the advantages of the contributory system is that both employers and employees make contributions, and sometimes governments also put resources into it as a way of subsidizing provision for example, informal wage workers or informal self-employed people. And when you move away from that system and you say we're going to finance it through taxation, then the big question is, how are we going to really raise enough resources to be able to provide all of these different benefits that we are saying have to come through a sort of non-contributory social assistance type of benefit, which has its advantages in covering people who work informally. But then the burden is in terms of shifting the debate to the question of financing, which becomes very important.
Thank you. Bijal, did you have any responses to any of those first few questions?
I wanted to talk about an insurance that was being managed by SEWA and not exactly for maternity leaves, but what they did was, so it was basically a group insurance run by SEWA for its members, and from within the premium which was paid to SEWA by the women themselves, a little part was managed to actually provide nutrition to women who were pregnant. So post-pregnancy nutrition for up to 3 months, that because the women would not assume that the women will not work, and also they needed extra nutrition which was not available. So our experience is that even if women's own organization tie up with larger insurance companies, once they have the experience, they actually manage to run these little cohorts that I should say collectively from the premium by the women, and make it more gender responsive in addressing issues that women face, in particular like post-pregnancy nutrition or probably cataract, which are not covered by other general insurance schemes.
Thank you. And Francesca, would you like to come back on any of those first three questions?
Well, on the question of social norms, just to say that, yes, there is research and practice on these topics. And I think I'll just make a quick comment regarding the messaging that surrounds, for instance, cash transfers. So we've talked about this expansion of non-contributory cash transfers. And in many countries, these are explicitly targeting women, women that are mothers or are primary care providers. And here, there are contexts where this has ultimately led to, reinforce the role of the woman as the care provider. She's the primary recipient, and at the same time, particularly when there are conditionalities attached in the form, for instance, of regular healthcare visits for children or regular school attendance, it's the responsibility for meeting these requirements falls on the woman, and this, it ends up reinforcing certain norms. There are also examples of countries, however, where equivalent or similar schemes have been accompanied, have actually followed quite different rationales and design details. They have targeted women as such, and not necessarily or focusing on their role as primary care providers. And this has meant that both in terms of messaging to women, but also to other family members, including men and boys, these initiatives have been accompanied with, as I say, messaging around the opportunities and the sort of pathways that women are hope to follow as a result of these interventions that do not necessarily need to focus on in terms of care and care provision. So I think there are ways, and of course then policy and legislation can help tackle or or support shifts in these norms. We've mentioned now, maternity leave, paternity leave, or anyway equivalent or similar initiatives can help address these sorts of norms and practices. On the digital side of things, I think there's no question that the technology, presents opportunities, particularly around, different stages of social protection delivery and management, and ranging from issues of identification of people that continue to fall through or are not identified, measurement of an identification of work that is still labeled as invisible in some sectors, and can, importantly facilitate the delivery of social protection to people, including women that are so-called hard to reach, perhaps because they live in remote areas and so on. So there's definitely elements of attractiveness there. At the same time, of course, we're well aware of the potential limitations. A key starting point in terms of limitations is that some of the most marginalized and women that are currently among the poorest groups tend to not have access to these new technologies, or indeed may disproportionately be excluded from them for a variety of reasons. So I think, however, and in moving forward, we need to be particularly attentive to any exclusionary processes that the reliance on these types of technologies may lead to.
Thank you.
I also wanted to answer on the digital, use of digital technologies to support social protection, and the fact that what had to be context specific and what care had to be taken. I would just like to quote our experience in cash transfers in the state of Madhya Pradesh in India, and we found that we couldn't do digital cash transfers in very, very remote tribal villages because the formal banking system hadn't reached yet, so we had to do cash transfers. And in general, small villages where we did general pilots, we also understood that having intermediaries like SEWA was very, very important, even though the cash transfers were undertaken, because the first step was through digital technology. The first step was they had to open an account, and for that they had to interact with the banks. And while some were very forthcoming, some were really, really rigid. And in a research that we did, we found that the pilot SEWA villages, 70% of the women said that they were extremely satisfied with the banks and the account opening system and the transfers, and the control only had 44% saying so. So that's a very valuable experience.
Can I just add one point, I think, on the social norms question, because it keeps on coming up. And I think we have to be quite, honest that, first of all, besides we keep on using the very good example of the sort of daddy quotas that the Scandinavian countries have, pioneered, and now more and more countries are adopting in making sure that there is a non-transferable portion of the leave, of parental leave, that fathers have to take. And I think we can recognize that that's really, really important, and that initial bonding that men do with children has kind of longer term impacts. Research has shown that. But the truth also is, as innovative as that instrument is, it's not a very useful instrument in countries where you have 90% of people who are working informally. So being able to use a kind of leave provisions to really change norms and get men to do more care work, I think it can be very effective in contexts where you have at least, a significant proportion of the population who are working formally and who are entitled to leave, so that you can use leave provisions to change those norms. So I think we have to be clear that we kind of don't have really such obvious examples of ways of shifting norms in other contexts. We don't have as many good examples and good instruments that can work. But at the same time, I think what Francesca said is really important in ways that we should be able to design even the cash transfers in ways that don't do the harm. They don't reinforce certain stereotypes. And I think the example of the child support grant in South Africa is quite a good one, in the way in which they designed that particular transfer, which was for children. And they consciously, the Lund committee, it was being headed by, Francie Lund, who was then the head of that committee. They very consciously said that the payment should be made to the main carer, and didn't specify mother. Obviously being very cognizant of the fact that families in South Africa are very diverse, and in many families, children are being cared for by others, by grandmothers, by other family members. So they didn't want to kind of have this maternalist idea put into their child transfer system. But still, even in South Africa, even with that labeling of having it as the main carer, if I'm not mistaken, something like 90% of people who use the child transfer, they are 90% of them are mothers. So the really important point, I think, is that if we know that in the end there's going to be a majority of women and mothers who are going to be using these transfers, I think it's an important question to really make sure that we don't then have all these additional conditionalities that reinforce the idea that women have a lot of spare time on their hands. So there, I think it's important to really, and there is a lot of very useful research, very good debates and discussion around the so-called benefits, but very often the drawbacks of these conditionalities. And I think it would be good in the context of CSW if we can really try and sort of question a bit more the usefulness of these conditionalities, which very often the added value is not very clear from research. The added value, it's a bit mixed, but the disadvantages in terms of imposing extra work have been documented and are very real. So I think it would be useful to have a discussion around those kinds of elements.
Thank you. We are out of time now for this webinar, unfortunately. Thank you very much to the presenters and to the audience for the questions being sent through. I think there's a slide to put up with some further reading and resources where we can continue the conversation. If that slide could be put up. Brilliant, thank you. So that's the further reading that's available from organisations that have been represented today. And the conversation can also continue on social media, on Twitter. And just to say as well, the next webinar on this topic, as mentioned, is on the 7th of March on the politics of gender responsive social protection. So thank you again to our panellists and to all of our audience. And yes, the recording will be available on the social protection platform soon. Thank you.
Thank you. Bye-bye.
Thank you.
Should we close?